Hi, I'm Jane Lesturgeon, and I create forms, tools, and tips that make mental health counselor work easier. In this brief presentation on SOAP note format, together we'll discuss the difference between subjective and objective data. We'll show concrete examples of subjective and objective data and help you gain confidence using SOAP format. As we get started, we all know paperwork can be a drag. Being better informed, though, about clinical note writing like SOAP format and having a quality form will really make your job much easier. SOAP is a popular format that many mental health therapists use to document important details from their client sessions. The subjective data is what the client states, reports, complains of, describes, etc. In other words, the subjective data is the client's viewpoint. Some examples of subjective data would be client stated feeling less depressed, or client reports feeling nauseous after taking medication. Client complained of being unmotivated to look for a job. Client described an intense argument with spouse after they had been drinking alcohol. Or client described feeling anxious and scared this morning while driving to therapy. So the takeaway tip for subjective data has to do with what the client shares, reports, describes, or otherwise expresses. It's not always easy to determine what is subjective and what is objective, but one way to look at it is the objective data is the therapist's observable and measurable and factual contribution, whereas the subjective data is from the client's viewpoint. Some examples of objective data might be focusing on mental health and mood status, the client's motivation level, their behavior, what you can see and observe and measure, physical health, emotions and affect, their level of functioning, and any personality issues. In other words, many of the same criteria used in your DSM-5 diagnosis. In writing, in the objective data section, the clinician might include things like the client was motivated to accomplish goals as evidenced by completion of homework assignment, or client wrung hands throughout the session, or client was experiencing a headache during the session, or client's emotions were labile, he swung from inappropriate laughing to crying. So the takeaway tip here is remember that objective data is mainly factual, it's normally measurable and observable. Now the A in SOAP stands for assessment, and this is where the therapist brings it all together and expresses his thoughts about what's going on with the client based on the S, subjective data, and the O, the objective data. Some therapists may also use this space to update the DSM diagnosis, to rule out or to rule in a diagnosis. But in any case, if there is a formal diagnosis, the assessment should tie into that. In the general sense, if one is using a formal DSM diagnosis, there must be enough evidence in the client assessment sections of your chart to support the diagnosis. Also, in focusing on the assessment portion of the clinical note will help you to keep track of and record any mental health criteria changes. So when writing the assessment, it's a good time to ask yourself if the client still meets the diagnostic criteria. Ask yourself, does the data support this diagnosis, or perhaps there would be a more appropriate diagnosis? The assessment should focus on those criteria that contribute to understanding the problem better and or reaching an appropriate and accurate diagnosis. For example, the clinician might write under assessment, client continues to experience depression and OS. Client has occupational and family stressors. Client expressing inappropriate anger. Client exceptionally fearful of being abandoned. Client test results showed hypothyroidism. So the takeaway tip for assessment is Assessment is where you make sense of and analyze or assimilate the subjective and the objective data. Now, the P in SOAP stands for plan, and the plan is essentially the action steps or the clinical interventions. It's presumable that the plan and clinical interventions drive treatment forward and encourage the client to meet their goals and objectives. So under the plan section of the SOAP, the therapist might want to focus on things like things both the client and the counselor are committed to doing. For example, the client rescheduled for the following week. Plus any interventions, such as the client committed to attending the domestic violence support group, or the client has attended 3 domestic violence support groups, or the therapist will continue EMDR and bibliotherapy. The next session, therapists will use guided meditation and assist the client in learning relaxation skills. Other interventions such as nutritional, medical, or physical fitness interventions and the like that contribute to the client's therapeutic goals and objectives should be noted. So the takeaway tip under plan is essentially the plan is a record of the action you and your client are committed to taking. So in summary, remember, review your SOAP note writing tips on a regular basis. And for more tools and forms to make your job easier, go to soapnoteexample.com or intakeforms.net or click the links in the description below this video. And for more Counseling Forms tips, subscribe to my Counseling Forms YouTube channel.